Good afternoon and welcome to Facebook Live. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for joining us for this field trip, and I have with me here Cindy Wadsworth. Hi, Cindy.
Hi.
And Cindy is the director of our Hematology Oncology Department. Cindy's going to give us a tour of the new space.
I am.
Okay, so she's going to be our guide, and we're going to kind of go through the brand new space, which, by the way, as we're doing this video, the open house is actually a few hours from now. So you're getting this preview before the preview. So how about that for you? So that's the plan. We're going to go through and take a look at the space. Cindy, you ready?
I'm ready.
Oh, and by the way, as we walk through here, tell us a little about the artwork that we're going to see here and there.
Yeah, the artwork we chose specifically images that would remind the patients of home, rivers and trees and cornfields, things that would help them feel more comfortable.
So basically like you're not in an office.
Right.
You're
Right.
out in nature, kind of that kind of
Yes.
calming effect that those type of things can have.
Yep, just to give them something to kind of be relaxing and maybe to get them to think about some pleasant things while they're here.
Sure. So I guess the first thing to look at, Cindy, would just kind of
Sure.
the waiting area. So let's come this way with us, if you would. Yeah, very nice and light. Anything to point out, highlight with this, Cindy?
We just wanted to give the patients somewhere to relax where they can watch TV, and we have a couple nice pictures in here as well, and we wanted to keep the vision open so reception would have easy access to see when the patients arrived or if they'd been waiting for a while, so that we can make sure that everybody gets taken care of efficiently and has a nice place to wait when they need to wait a little bit.
Yeah, and actually what we'll do while Cindy and I are standing here, we're gonna disappear for a minute and we're gonna kind of give you a little panoramic and kind of show you so you can see. This is a lobby and then the reception area in front of us here. So yeah, that kind of gives you a sense of the space that we're talking about. Thanks, Liz. And so Cindy, just the way it's laid out, if you told me right, there's two entrances and one is for tell a little bit more about that.
So you'll see when we go into the department, but basically the department is set up so the clinic side is to the right, and then the patients, prior to seeing the provider, will enter that side and the MA will take them to their exam room. Where our infusion area is to the left, so if they're here strictly for infusion or an injection or a port draw, they'll enter through the left door and then the nurse will take them back for that. And of course we have patients who have the visits where they see the provider and then they go to infusion, and so they'll just move from the clinic side to the infusion side in the back. And we can kind of show you that when we go into the department.
Yeah, good. That's kind of a nice flow there to have that in place. So good. Well, this is kind of the lobby area. What we're going to do next is we're going to take you back and to see the inner workings of the department. Are you ready, Cindy?
I'm ready.
Okay, let's do it. So we're about ready to enter here in the space, oncology space, where things will happen for patients. By the way, just so you guys know, so Cindy and I go way back. Cindy, I think it was this week, 25 years ago, that I started practicing in Morrison. And I think, a couple years after I started practicing, Cindy came aboard and was a nurse practitioner with me for
17 years.
Not that she's counting, she loved every day, but she was just saying it was 17 years. So
17 very short years.
Okay, so anyhow, that's Cindy and I go way back, and she's done a great job here in the oncology department. So Cindy, let's have you show us the way.
Okay, so the patients will come back, and this is the MA station. So this is where the MAs are located, and they'll keep all of their paperwork here. And then they'll weigh the patients, which we don't have the scales in yet, but they'll weigh the patients over here in the corner and measure them, and then we'll take them to the patient room, whichever one that they're going to, and we could show them one of the
which
exam
direction should we go, Cindy?
Let's go this way.
Okay. Follow us, please. Okay.
So this would just be an example of one of our
I'll let you go in there, Liz, and kind of show folks. We were talking, Cindy, the exam rooms on the left where Liz is looking, they'll have computers and stuff like that, right?
Right, yep.
Okay. But for now, at least, that gives you a sense of, so nice, roomy exam rooms. spacious, if you will.
And actually right now we have 6 exam rooms downstairs.
Okay.
So we have grown in our volume by adding our new doctor, Dr.
Okay.
Al Sayed. So now we will have 9 exam rooms.
Okay. Yeah, that helps. That would help quite a bit, I would think.
Yeah, for
yeah,
sure.
Yeah. Okay, great.
Okay, so this area is where we have our phone nurse office over here. And she basically is the person that's manning the phone. So when the patients call in and they have concerns or questions,
Sure.
she takes care of that throughout the day. And then when the providers need something from the nurse for one of the provider visits, then they will go to her. And then right next to that is the office for the nurse navigator, Sue Hageman. One thing that's kind of neat, if maybe I could show you, is in the offices, we wanted good communication, right? Because we're always talking. There's always a conversation between the nurse navigator, reception. So if you want to step in here real quick and kind of show, we have windows in between so that they can continually communicate. And if they need a little bit of privacy, we can.
What's that over there, Cindy, where Liz has her camera now? That's the reception.
That's reception.
Okay. Yeah,
Yep.
just so folks get a sense of that.
And we're like, Sue is always communicating with reception because she is the intake coordinator. So she's really managing the schedule as well. So they talk back and forth all the time. So that makes that
really nice.
very convenient for them.
And some nice privacy here with these doors too. So I like that. That's great. So what's next? What do you want to show us?
So a little bit further down this hallway, we have an entrance to reception, kind of a back entrance for them. And then we also have 2 draw rooms. These 2 rooms are the drawing rooms. And this is where we will do port draws for the patients if they need labs drawn and port flushes. And then we'll also do our injections in these 2 rooms. And they're very similar to what you would see in the lab.
So Cindy, where are we at now? What are these rooms?
These are our 2 infusion rooms. Downstairs right now we have 1 private room, and we typically put patients in that room that require a little bit extra care. So moving upstairs, we added another one. Now we have 2, and I'll open them up for you so you can see we have a hospital bed in here, and there's just a little bit more room and obviously privacy for those patients that need that.
So what kind of patients would you have would need this kind of room, Cindy?
Sometimes people are just in a little bit more pain and they just need some privacy. If people are wheelchair bound where they really can't transfer on their own, or they need a Hoyer lift, for example, to transfer, then we usually will keep them in a bed. So we can just easily bring the Hoyer lift in here and transfer the patient into the bed.
Yeah.
So it's just those people that need either privacy for whatever reason, or if there's more mobility issues.
Good.
And sometimes we have people that do require a caregiver, for example, to stay with them. So this would be an opportunity to accommodate those patients.
Yeah, nice. Okay, so we've seen a couple of private infusion rooms. What's next, Cindy?
Back here we have the nurses station. All the nurses that are chemo certified that will be administering the chemo will sit back here.
Okay.
And then we'll have the nurses that are responsible for this side of the infusion center sitting here, and then I'll show you the other side.
So let's come with us, Liz, if you would, and we'll take a look around here. I'll let Cindy kind of do this tour, and I can stand back a little bit.
So alongside the wall are the infusion bays. We don't right now have the chairs in there, but there'll be an infusion chair in here, and then the TVs for the patients to watch TV.
And then we can walk down here and see a lot of nice light there.
Mm-hmm. Yep, so we did add a couple windows because we wanted to make sure that it was light and just a positive environment for the patients. Right now downstairs we have 6 infusion bays. So up here we've expanded to 11, and then we'll just show you walking around. Each infusion bay is basically the same. And then in the corner we just have kind of a larger area, which will be 2 infusion chairs together.
Nice.
With a separation in the middle.
So then, and then you basically have you have 2 wings, really.
Mm-hmm.
Okay.
Yep.
And then this is right here is the
nurses station is here, so you get a little bit different angle. And this was one thing Dr. Ali Khan really wanted, was to have the arched design for the nurses stations and then have the infusion chairs surrounding them in the circular fashion, just because it's really good visibility. Everybody can see the patients very well, and it keeps everybody with that patient view access.
Good.
So I think it turned out really nicely.
Yeah, yeah. Okay. Well, hey, let's go down kind of the back hallway here. Okay, so we're about ready to leave about done with our field trip. So everybody, thanks for taking the time to be part of this. And what's this, Cindy?
These are lockers for the staff.
Okay.
They're very excited about it. We have lockers now.
I see names on here already.
Yes.
People have put their names up.
Yep.
Okay.
Yep.
Well, I think I should do the same.
You do.
Can I have a locker up here in the oncology space?
Sure. Why
okay.
not? Why not?
All right. I'm gonna put my. They won't. They probably won't care if I do this. So I'm gonna put it right here. And they're gonna go. Who is Bill? Right here, Bill. All right. So I've got myself a locker now. So thanks. I'm glad I did this field trip to be able to have that.
Yeah, isn't that nice? It's
That's
the perks.
so nice.
It's one of the perks for being the Facebook Live guy.
That is, boy, talk about quite a deal. I don't have to walk like about 200 yards to get to my locker now, but oh well. Everybody, thank you so much for taking the time to watch this field trip. I hope it was helpful and informative in terms of what the space, and we're really proud of the space that we have up here to take care of patients who have cancer and or other blood kind of issues, and so it's great to have this space now. Please post this and share this and like this and all the stuff that you do with this kind of thing so that folks get a chance to see what's going on here at CGH with oncology. Anything else you wanted to add, Cindy?
I don't think so.
Okay. I just would just say this, that, and I've said this many times, but our team that takes care of patients that has cancer, it's phenomenal. Cindy does a marvelous job. All the doctors, Lindsay, who's our nurse practitioner, all the nurses, receptionists, just it is I couldn't be prouder of the work that we do here in oncology here at CGH. And you never want to have cancer, but if you do, I just feel so good about the fact that folks can come here and get outstanding care if they have some type of cancer and need that taken care of. So
I would just echo that too, how you said we hope that no one has to go through that experience, but if you do, we're here for you, and we will do our very best to take such good care of you.
yeah. Thanks, Cindy.
Thank you. Thank you.